Hey there, rebels and reclamation warriors. This is Dr. Misty with Untamed Ember, and today we're diving into something that most people are too uncomfortable to talk about but desperately need to understand: why oral sex can feel triggering as hell, even when you genuinely want it. Before we go any further, let me be crystal clear. This episode contains explicit discussion of sexual practices and trauma responses. If you're not in a space where you can listen to frank talk about oral sex, save this one for later. And if you're a trauma survivor who might find detailed discussion of oral triggers activating, please take care of yourself first. That said, if you've ever wondered why something you want intellectually feels impossible physically, why your jaw clenches during oral sex, why you gag or panic even with partners you trust completely, or why you feel like you're suffocating when someone's genitals are near your face, this conversation might finally give you the answers you've been looking for. Let's start with some anatomy that nobody taught you in sex ed. Your jaw isn't just for chewing food. It's one of the most neurologically complex parts of your body, directly connected to your vagus nerve, your fight or flight response, and your body's threat detection systems. When you clench your jaw, you're not just tensing muscles, you're activating your nervous system's protective responses. Your jaw is where you hold every word you couldn't say, every scream you swallowed, every time you bit your tongue to keep the peace or stay safe. And here's what's wild. Your jaw is also directly connected to your gag reflex, which isn't just about physical sensations. Your gag reflex is part of your nervous system's threat response. It's designed to protect you from choking, from having foreign objects forced into your throat, from suffocation, so when someone's genitals are near your face, even if you want them there, even if you initiated it, your nervous system might interpret that position as inherently vulnerable or threatening. You're in a position where your breathing could be restricted, where you have limited ability to speak or move away quickly, where someone else has a significant amount of control over your physical experience. For trauma survivors, especially those with any history of sexual violence, emotional abuse, or even chronic powerlessness, these positions can trigger protective responses that have nothing to do with your conscious desires. Let me share what this might look like. Maybe you're with a partner you trust completely. You want to give them oral pleasure. You're genuinely turned on and excited about it. But the moment you get into position, your jaw locks up. Your breathing becomes shallow. You start to gag before anything even happens. Your nervous system floods with anxiety or panic that seems to come from nowhere. This isn't psychological dysfunction. This isn't you being bad at sex. This is trauma stored in your body expressing itself exactly as trauma does, through physical responses that bypass your rational mind completely. For those raised in purity culture, oral sex carries additional layers of shame and complexity. Many religious environments teach that oral sex is degrading, sinful, or somehow dirtier than other forms of intimacy. They create associations between oral contact with genitals and moral corruption. Even if you've intellectually rejected these teachings, your nervous system might still be running the old programming. Your body might still associate putting someone's genitals in your mouth with being dirty, sinful, or degraded, creating a massive internal conflict between what you want and what your body feels safe doing. Purity culture also teaches, especially to people raised as girls, that their sexual pleasure and comfort should always come second to their partner's needs. This creates a dynamic where you might feel obligated to perform oral sex even when your body is clearly signaling that it doesn't feel safe, leading to repeated experiences of overriding your own boundaries in service of someone else's pleasure. There's also the issue of power dynamics. Oral sex, particularly when you're the one giving it, involves a level of vulnerability and submission that can feel threatening if you've experienced powerlessness or abuse. You're literally in a position where someone else could control your breathing, where you could be held in place, where your ability to communicate is limited. For some trauma survivors, this vulnerability feels impossible to tolerate, even with partners they trust completely. It's not about the partner, it's about the position itself feeling too reminiscent of past experiences of powerlessness. Now let's talk about the nervous system responses that might show up during oral sex. Understanding these can help you recognize what's happening in your body and respond with compassion rather than judgment. Sympathetic activation might look like your heart racing, shallow breathing, muscle tension throughout your body, feeling like you need to rush or get it over with quickly, or a sense of hypervigilance where you're constantly monitoring your partner's responses instead of staying present with your own experience. Dorsal vagal shutdown might show up as numbness or dissociation during the act, feeling like you're watching yourself from outside your body, losing sensation in your mouth or jaw, feeling disconnected from any pleasure or enjoyment, or going through the motions while feeling emotionally absent. Freeze responses might manifest as your jaw locking up, being unable to move or change positions even when you want to, feeling paralyzed or stuck in place, or your body becoming rigid and unresponsive. And then there are the specifically oral responses. Gagging that seems disproportionate to what's happening, feeling like you can't breathe even when your airway isn't actually blocked, jaw pain or lockup, difficulty swallowing, or a sense of suffocation that comes from nervous system activation rather than actual breathing restriction. All of these responses are your nervous system doing exactly what it's designed to do: protect you from perceived threats. The problem is that these protective mechanisms can't distinguish between actual danger and situations that merely resemble past dangers. So how do you work with these responses? First and most importantly, you don't have to fix this. You don't owe anyone oral sex. If oral sex never feels safe or enjoyable for you, that's completely valid and doesn't make you broken or inadequate as a partner. But if oral sex is something you want to explore or reclaim, there are trauma-informed approaches that can help expand your capacity gradually and safely. Start with nervous system regulation outside of sexual contexts. Work on general jaw release practices, breathing exercises that activate your parasympathetic nervous system, and somatic practices that help you feel more grounded and present in your body. When you do explore oral contact, go incredibly slowly. Start with non-genital oral exploration, kissing, licking, or sucking on fingers, toys, or other objects that feel completely non-threatening. Let your nervous system learn that having things in your mouth can be pleasurable and safe. Practice what I call empowered positioning. Instead of traditional oral sex positions where the receiving partner has more control, experiment with positions where you maintain more agency. Maybe you're on top, controlling depth and pace. Maybe you're lying side by side. Maybe you use your hands primarily and your mouth secondarily. Communication is crucial, but it needs to go beyond, "Tell me if you want me to stop." Create specific signals for "slow down," "different angle," "I need a break," or "that's perfect." Practice using these signals in non-sexual contexts so they become automatic. Most importantly, practice what I call consent check-ins with yourself. Throughout any oral encounter, keep checking in with your own body. How am I feeling right now? What does my nervous system need? Am I staying present or starting to dissociate? If you notice activation or disconnection starting, it's not a failure to pause, breathe, change positions, or stop entirely. It's actually a success. You're listening to your body's wisdom instead of overriding it. For partners of trauma survivors, this means creating space for nonlinear healing. Your partner might be fine with oral sex one day and triggered by it the next. They might need to stop suddenly or change positions frequently. This isn't about you or your desirability. It's about their nervous system learning to feel safe with vulnerability. Let me share a gentle jaw release practice that can help trauma survivors begin to soften the tension they're holding in this area. Place your hands on your jaw joints, just in front of your ears. Gently massage in small circles, breathing deeply as you do so. Open your mouth slightly and move your jaw side to side very slowly, noticing any areas of tension or restriction. Place your tongue on the roof of your mouth and breathe in through your nose, letting your jaw soften and your face relax completely on the exhale. Try gentle humming or ah sounds, feeling the vibration in your jaw and throat. And most importantly, if emotions arise during jaw work, if you start to cry or feel angry or remember things you'd forgotten, that's normal. Your jaw has been holding a lot, and as it releases, emotions might surface too. As we wrap up today's conversation, I want to leave you with this. Your sexual responses aren't moral judgments. They're not character flaws or signs of weakness. They're information about what your nervous system has experienced and what it needs to feel safe. If oral sex triggers you, that doesn't make you broken. If you love oral sex, that doesn't make you dirty. If you're somewhere in between, that's valid too. Your relationship with oral pleasure gets to be whatever feels authentic and safe for your unique body and history. Your triggers aren't obstacles to overcome, they're wisdom to integrate. They're your body's way of saying, hey, I need us to go slower here, to build more safety, to approach this differently. And for those of you healing from sexual trauma, please remember, reclaiming your sexuality isn't about returning to some previous state or meeting external expectations about what healthy sexuality should look like. It's about discovering what feels genuinely good and safe for you, right now, in this body, with this history. You don't owe anyone access to your mouth, your body, or your sexual energy, and you don't have to heal in any particular timeline or in any particular way. Your healing gets to be as unique as you are. This is Dr. Misty with Untamed Ember, reminding you that your mouth is sacred territory, your boundaries are holy, and your pace of healing is perfect exactly as it is. Until next time, keep listening to your body's wisdom, beautiful humans.